Today, we will talk about autism tests in adults typically involve a comprehensive evaluation of behavior, communication, and social skills. The key components and considerations in an autism test for adults are: the first one is clinical interviews, in which professionals may conduct interviews to gather information about an individual's developmental history, social interactions, and communication skills. They might inquire about early childhood behaviors, milestones, and any challenges experienced in social situations. Then next step is behavioral observations, in which direct observations in various settings help assess how an individual interacts with others, handles social cues, and manages sensory experiences. Observations may focus on repetitive behaviors, use of nonverbal communication, and response to changes in routine. Then third is self-report, in which adults may be asked to complete self-report questionnaires to provide insights into their own experiences, preferences, and challenges. These questionnaires often cover areas such as social interactions, communication, and sensory sensitivities. At the end, they are gone through Autism Quotient ACT test, in which the Autism Quotient is a self-administered questionnaire that assesses traits associated with autism. It covers areas like social skills, attention to detail, and preference for routine. A higher score on the AQ may indicate a higher likelihood of having characteristics associated with autism. Additional test involves cognitive assessments, in which intellectual functioning is often assessed to understand an individual's cognitive abilities. This may involve standardized tests measuring IQ and cognitive processing. Then there is adaptive functioning assessment, in which professionals evaluate an individual's ability to perform everyday tasks and adapt to their environment. This can include assessing independent living skills, self-care, and communication in practical situations. There is medical evaluation, in which a medical examination may be conducted to rule out any underlying health issues or conditions that could be contributing to certain behaviors. Genetic testing may be recommended to identify any genetic factors associated with autism. Last test involves sensory profile, in which evaluation of sensory processing is crucial, as many individuals with autism may have sensory sensitivities or seek certain sensory stimuli. Assessments may explore an individual's response to sensory input in various modalities. And social communication assessments, which is standardized tools, are used to assess an individual's social communication skills, including verbal and nonverbal communication. Eye contact, gestures, and reciprocity in conversation are often evaluated. It's important to note that the assessment process should be conducted by trained professionals, such as psychologists, psychiatrists, or developmental specialists.